Welcome back to The Big Picture. We are talking with Dr. Raul Vazquez, getting an update on COVID-19 virus and everything to do with it. So for a while, Doctor, we were talking about infection rates being higher with minority populations, and I don't know if that's true anymore, is it? And if so, you would know.
I think what we did was we started looking at the data because we tested over 15, almost 2,000 people. So what we saw was that the COVID positive test among the Latino population was actually 52%, which was higher than the African American population, which what we were testing. Now, the antibody test that we began to do after the exposure was the opposite. We saw about 52% in the African American population and about 36% in the Latino population. So it just meant that, African Americans were infected, but we weren't able to kind of test them. And the antibody test was just a secondary test for that group.
Do we know why? I mean, is there a medical reason why that population would be more susceptible?
Yeah, the lack of primary care services, the lack of chronic disease management. So you have a lot of diabetes, hypertension, and asthma. And not if those things are being managed with some of the medications, people do better. But that and lack of primary care. There's not a lot of individuals that get the primary care they need.
And underlying conditions. I guess one follows the other because you mentioned the underlying conditions. Now, the big question is, if someone does test positive for COVID, what should they do? Well, we don't, obviously there's some new remedies we've heard about. There's some new treatments, some new medications. What should they do?
I mean, so, the biggest thing is to make sure they don't give it to anyone else. So we give them instructions as to what to do at home. In some cases, some patients get a little kits to make sure that, they have sanitizer. So things that are real important and masks if they don't have some. Really, the environment in the home still becomes a major issue with bathrooms, but all that precaution is key. If they're symptomatic, there's other things we're trying now. So if we find someone that's developing some respiratory types of symptoms, we get an x-ray to make sure that they don't have a pneumonia. We get a pulse ox to make sure they're not hypoxic. But in some cases, we're using some of the steroids. So the dexamethasone or the prednisones to kind of alleviate the cytokine storm that we didn't have. There are some drugs that are parasite drugs that we used in the past that interfere with this virus coming in. So in some cases, we've actually used those just to be able to kind of shorten the course. And we've been pretty successful with that. Now, remember, a lot of this stuff is not approved. And at this point, we have situations that if we use these things, people do better. The medications they're approving at the hospital level, it does well, but you're stuck with trying to at least make the patient comfortable. And just, making sure they don't have the flu, because if they do have the flu on the testing, there's medications that we can use for the flu that'll prevent the flu from getting worse.
It's very hard, obviously, from the patient's point of view to know whether it is COVID. I know, speaking for everyone I know, every morning if I wake up, if I sneeze or if I cough, I think, oh my gosh, it's COVID. So it's hard for people to know the difference.
Right, and it's tough because they're viruses. They're in some cases they're both different types of coronavirus. So the symptomatology is going to be very similar. The only thing is that with COVID, as you know, the symptoms get worse pretty fast. So you're going to have people that are coming in, not just with the cough and shortness of breath, but in some cases chest pain. And that chest pain is always indicative of a possible pneumonia. And the other problems with it is because it causes inflammation in all the vessels. If you have conditions like, coronary heart disease, you may develop a heart attack with these kind of coronaviruses. Blood clots, you could form blood clots. And depending on where the corona inflammation takes place, different organs may present with different symptoms. So some people it doesn't get so much in the lungs, but more in the nasal passages, and they develop more of the GI, the loss of taste, loss of smell, the nausea, the diarrhea. So it's just a lot of things, and you should call your primary care doctor if you develop these symptoms, because they'll be the best guide for you. Don't just show up at an office or in the emergency room. You need to call and let them know that this may be, a possible diagnosis.
That was kind of my next question. What if you did test positive? Oh, I know. Going back a step, who should get tested? How do you know when you should get tested, assuming you don't have symptoms?
Well, yeah, I mean, the county hospitals are doing healthcare providers, people that are exposed a lot. So that's one thing. I think symptoms. I mean, if you have fevers, cough, those are the ones that are going to often run into shortness of breath, chest pain. A lot of the viral types of symptoms are going to be the ones that need to be tested. If you're around someone that was positive, yeah, you're also going to need to be tested, because we want to make sure that there wasn't that exposure that took place. Because if not, you'll become a sort of a carrier within your family, and that makes things a lot worse.
That's why we have the contact, letting people know, right? Now, many people are talking, and we mentioned it before, about what would happen if we had to go to red, and you mentioned it before, to the worst situation. Would it be more devastating if we had a shutdown than it was even in the spring, with the holidays and everything coming up?
I mean, you have to, I think what'll take place is, it's going to go back to what happened in March. You're going to see the cases go up, and then you start seeing the emergency room and the death rates climb again. So at that point, I mean, it just makes sense to kind of prepare, not just kind of assume that things are not going to get, worse before they get better.
And I know I recently heard, for example, that you yourself in your practice had closed the clinic or changed the way you're seeing people or how people could get to you or come for help. So I know it's you, and probably everybody else is following that.
Yeah, and I think what we wanted to do was, I don't want to be a Nevis for infection. So if you're bringing more and more infected, no matter what protocols you're following, you're going to get people infected. And our rates were up to about 10 to 12 and climbed to 15%. So that, in my case, it's sort of like the trajectory. You start here and now you're going up here. I felt that we could do a lot of the same work, not get the staff sick, and just switch to a telehealth model. But which, within the websites, they can call in, they get a link, they get a video visit, and then if anything needed to be medically examined, we have equipment to get out there to actually check people if we needed to. But through there, if they need meds or anything else, we could easily channel it through. If you had symptoms of COVID, all the information's there, and our mobile unit would be outside. And once the mobile unit was outside, you just come in and you get tested for COVID, and then we'll know if you had COVID or not. So the unit, we kept everything outside the building because we feel that would be a much better approach. And we do have a mobile unit with examining rooms and things like that can be easy clean. The PPE equipment, you don't burn it up as much as if you're doing the whole 2 sites. And so we wanted to centralize our operation.
And I know you've been so accessible to the population and the people that you serve. And as far as people that can go to you for help, do they have to be a patient beforehand with you, or to have some relationship, or what would somebody do if they needed help? If they needed to be tested.
Yeah. So what we do is we have, so even people that are not part of our practice, what we have to do is schedule a telehealth, because the state, all the tests we do have to be reported up to the state. If you don't have all the information done correctly, you can be fined $2,000 per test. So we bring people in as patients, and you can change your doctor for 30 days, and then you go right back to your doctor. But then we get all the information that's needed, and we run the test. The test gets pulled out and sent to the state, and we can give you an easy result. But we're willing to do that with anyone, but they have to become a temporary patient if we're doing these tests, because the follow-up and everything else is not just come do the test, and it's hard for us to do our contact tracing and really track down the things that need to happen.
You keep saying it. You said, and everyone is always saying, call your primary doctor if you feel. Don't just go to the hospital, or don't just show up or something. But a lot of people don't have a primary doctor. What do they do?
Well, I mean, we have our office number is 882-0366. We're always taking patients. If not, we have other physician groups that we can refer you to. I'm part of 2 different systems. I'm part of GBON. We do a lot of care coordination. We manage about 8,000 lives, and we have navigators to help. But we're also part of Jabanco, an ACO, and we have about 250 physicians in the network. So there's a lot of different ways that we can direct you to another provider if that's the case. But for the test, we have you switch to urban, because it's just much easier. And since there's so many cases coming in, it makes our protocol kind of easier to follow. Otherwise, it would be very difficult.
And I guess to kind of repeat, not to keep saying this over and over again, but for the holidays, like for Thanksgiving, it's a little early for other holidays, but let's say Thanksgiving, people should do what? Should just stay with their immediate family, or stay alone, or what?
Well, you know, some people have quarantined over the 14-day period, you know? So do that before, you know, you're going around someone that, and hopefully everybody in the family, stay close to the people that you live with. I think it makes it easier. If you do have to go with a family member, make sure you quarantine for 14 days. And you know exactly that you don't have something. But yeah, it's gonna be a different type of Thanksgiving and Christmas. But we're gonna have to, a little sacrifice. The good thing is the vaccine's coming. And I think the vaccine will be successful. But we're not gonna look to any normalcy till March or April next year.
So hang in there, everybody. So hang in there, right? Thank you so much, Dr. Raul Vazquez from G Health Enterprises, for our COVID update. If you'd like more information, please go to their website, ghealthenterprises.org. Thanks for watching The Big Picture. Thanks for watching WBBZ-TV, and stay safe, everyone.
I wear a mask because
I wear a mask because it's a tiny sacrifice to protect your freedoms.
I wear a mask because I can help stop the spread of COVID-19 in my community.
I wear a mask because I care about you, even if I don't know you.
I want to keep doctors, nurses, and other essential workers safe.
I wear a mask because I can, but my baby can't.
I wear a mask because I want to feel safe sending my kids back to school. My kids wear masks to keep their friends safe.
I wear a mask because I want you to stay healthy.
I wear a mask because I really want to get a haircut soon.
I wear a mask because I care about the health and well-being of those around me.
I wear a mask because I might not know that I'm sick.
Yo uso una máscara para mi familia y la comunidad.
I wear a mask because I want to keep others safe.
I wear a mask because I want to protect everybody.
I wear a mask because too many people who look like me are getting sick and dying from COVID-19.
I've grown fond of seeing people smile with their eyes. It's a beautiful experience in these times.
Do it for their futures.
Even if you don't have to, I hope you choose to.